Weight's always been kind of a lifelong struggle for me, but really back when I was 45 or so, the weight became unmanageable for me. It got to the point where diet and exercise just wasn't the answer anymore. It was on my 48th birthday, so almost 3 years ago today, I really made a silent declaration to myself that when I turned 50, I just had to be in a better, healthy place for myself and for my son. Prior to my surgery, I really felt landlocked. I really didn't go outside for various reasons. A lot of self-consciousness, just beyond the physical aspect of being able to get up off the couch and go do those things without, physically able to go do them. And I really felt, kind of a prisoner inside of my own house at that time.
With morbid obesity, I always challenge somebody to give me an idea of an organ or a system in the body that's not negatively affected by morbid obesity. Like so many of our patients, Jim was a diabetic and suffered from gastroesophageal reflux, hypertension, sleep apnea, and a host of other conditions. That's just to name a few. And those are the conditions that come together and can affect and erode a patient's health and lead to a decrease in longevity.
My goal simply going into the surgery was I wanted to be healthy again. I wanted to be able to be active. It was always about longevity. It was never about vanity for me. I wanted to see my son grow up, and I wanted to see him go to college and have a family of his own. My first meeting with Dr. Dan, my surgeon at Summa Health System, was a wonderful experience. Dr. Dan put me at ease right away. We discussed the options. He took as much time as I needed during that initial consultation, answered every question that I had, however trivial that it was. Before I left that initial consultation, I felt very good about my choice in surgeon.
When I met with Jim, we did discuss the various surgical options. It's important to try to match the patient to the right procedure for them. And that can depend based on the patient's past medical history, past surgical history, and goals. Jim looked at all the options, and we felt that laparoscopic Roux-en-y gastric bypass was the best option for him.
I really used my photography as a method to keep me busy post-surgery. It was something that I was interested in before surgery. I got interested in it with my son and the sports that he played. And really post-surgery, I kind of developed my own personal mantra of go create. If I have enough time to sit on the couch, then I have enough time to go create. So when I find myself with nothing to do, it's pick up the camera and head out the door and go create.
Our biggest attribute, our biggest help is a motivated patient who wants to take charge of their health and wants to make a difference in their own quality of life. So we provide patients in bariatric surgery with an excellent tool and an operation which helps them along the way. But really it's the motivation and the compliance of the patient, like patients like Jim, that has so much to do with the long-term success.
There is an answer out there. For a long time, I didn't feel there was an answer. The only answer I was given was diet and exercise, and there are other answers. You just have to do the research.